I am a stereotactic and functional neurosurgeon. My main specialty is treating patients with movement disorders like Parkinson's disease, essential tremor, Tourette's, dystonia, and also epilepsy patients. Let's see this side. I also do general neurosurgery and take care of patients with brain tumors, with spinal disorders. I'm the only functional neurosurgeon really in North Louisiana and in the area that does epilepsy and movement disorder, from probably the Mississippi border all the way to Dallas. It prevents people from having to travel all the way to Dallas or travel to Little Rock or New Orleans. My little sister has spina bifida, and I decided that I wanted to take care of patients with neurological disorders like my little sister had. I initially wanted to be a pediatric neurosurgeon, but after meeting the patients with movement disorders and epilepsy, I fell in love with that patient population, and I really felt a real calling. Functional neurosurgery, treating patients with deep brain stimulators and implants, it's on the cutting edge. It's like where the future is at in neurosurgery and really in medicine. Deep brain stimulation is kind of like a pacemaker for the brain. It can respond to neurosignals in the brain and turn things off. In Parkinson's disease, you can have upward to 60 to 80% improvement in your symptoms. It's a very life-changing procedure. We've had a patient who played the guitar and sang and couldn't do that anymore, and then after deep brain stimulation was able to go back to doing those things. So. Other things that are coming are treatments of other diseases like blindness. There's just a slew of research being done across the board into different areas, including dementia and things like that. Ochsner LSU Health, they have been extremely supportive in getting the equipment that we need to treat patients. They're very open, providing facilities. They have state-of-the-art imaging. We can now do all of the imaging that we might have prior sent people out to get. We can now do that inside the clinics. It's a very good relationship. I tend to things. I have a garden, I'm a beekeeper, I like to keep chickens. We have a little boy, we like to go to the park or just run around in the backyard. I tell people now most of my hobbies involve playing with blocks and playing with toys, because that's what my 2-year-old likes to do. So, guys, look this way, this way. Yep. A lot of times we focus a lot on labs and on imaging, and I think that those things are great, but you're going to tell me how you feel and what's most important to you. If you just listen to people, they're going to tell you what's wrong with them and what they want to do about it. Coming to clinic after you do surgery and they've not been able to feed theirself for several years, and you turn on their stimulator and all of a sudden they have pretty normal function again is very rewarding. Giving back to this community that honestly raised me is very, I feel really blessed to be here and get to do this in this area. It's actually a lot of fun, and it's very rewarding to get to work with these people.